Good morning, everyone. Well, this is Healthcare Heroes Appreciation Week, and we are blessed in Lexington to have an incredible community of healthcare workers. So I want to say, first of all, thanks to each and every one of you. There are quite a number of you in the audience and up here behind me. And I'll just say you have saved countless lives during this pandemic. And as a registered nurse, I could not be more proud. Thank you very much. So one of the things we want to do today is to celebrate the accomplishments, to celebrate those of you who serve on the front lines, and those who have worked tirelessly. Pause. There we go. Those who've worked tirelessly to encourage Lexington residents to get tested and to get a vaccine. So we have great news this morning. Today, Lexington, Fayette County is 70% fully vaccinated for all Lexington adults 18 and over. This is a huge accomplishment. Thank you. I'm going to look to these folks. 70%. So we are well on our way. We continue our laser focus on this issue. Unfortunately, today is also a day for continued vigilance. On the same day we made it to 70% vaccinated, we are also reporting for the first time over 40,000 cases in our city since this pandemic started. Our 7-day rolling average is 185 cases per day. The fight continues for all of us, including the healthcare heroes who have joined us today. Before Lexington had its first COVID-19 case, Lexington had a team of healthcare stakeholders ready to work together to help our citizens through this pandemic. And several of them are right here joining me today to provide updates on the pandemic, which we continue to fight. There's a lot of COVID news right now, a lot of important changes to keep up with. But every one of the folks right here was either on the Fayette County Stakeholders Group for the past 18 months on weekly calls or had someone representing them. This was a huge, wonderful opportunity for healthcare stakeholders and public safety folks to share information, to ask each other questions. And we are still going at it as we speak. So let's start with some introductions. And first I want to recognize Dr. Daniel RODRIGUE, Infectious Disease Specialist, CHI St. Joseph Health. Where did you go? There you are. Dr. John Wilson, is he here? There you are. Deputy Chief of Staff for the Veterans Administration. Dee Beckman is our Chief Nursing Officer for Baptist Health. Dr. DEMETRUS LIGGINS, our brand new Superintendent of Fayette County Public Schools. I told him he came just at the right time. Dr. Deborah Stanley, Chief Medical Officer, Health First Bluegrass. We have quite a few others with us. We can't forget Kevin Hall, Communications Officer for Lexington Health Department. There you are. Andrew LANHAM, Public Affairs at Wild Health. Thank you. Chuck Mix, who co-chairs our city's vaccine task force efforts. Tim Brandywee, with our Division of Emergency Management. Tim. We have Fire Chief Jason Wells. We have Police Chief Lawrence Weathers. We have Polly Ruddick. Now, how come you're not up here? Polly heads up our Homelessness Prevention and Intervention Office, and I've missed some folks. Let me look here a second. Who have I missed? You're with the VA too? Excellent. VA is here in full force. Thank you very much. These folks represent a small number of the people who have been on these weekly calls, week in and week out for the last 18 months. Now, I want everyone who wants an opportunity to speak today to have a chance. I'm going to start with some bullet points that members of the group have contributed, and then we'll get to our speakers, each of whom has specific information to share. First, we need to underscore the continued importance of getting a free vaccine. COVID-19 is surging. In 4 months, March through June of this year, we had just over 3,000 confirmed cases. Now, in just the past 4 weeks, we've already had over 4,000 reported cases. By a significantly large margin, most patients now in the hospital with COVID-19 are people who are not vaccinated. The FDA has now formally approved the Pfizer vaccine, and we are hopeful this will encourage more people to get a vaccine. Lexington is seeing a significant increase among young people. About 15% of current cases are occurring in children ages 5 through 17, with a significant increase since June. Vaccines are available for children ages 12 and over. Please do not go to the emergency room for a COVID test or a vaccine. Our hospitals report that emergency rooms are already overcrowded with COVID-19 patients. It's important to get tested to slow the spread of COVID-19. There are new free testing options for pre-K through 12 students, teachers, and staff. And this is a huge step we are trying to keep our children in school. We've partnered with several entities in our community to add to the testing. This helps build our resiliency as we fight the virus while keeping our kids in school safely. The new test sites will relieve the pressure on the College Way site, where the public has access to free testing. And I want to thank the University of Kentucky for all it has done for our community with testing and vaccines, plus the care that has been given to COVID cases in the university's hospital. Wear a mask, especially when you're indoors in a crowd. A third dose of the vaccine is available now at the Lexington Fayette County Health Department for those who are immunocompromised. The CDC is developing its plan to begin offering COVID-19 booster shots this fall. Now, let's hear from our speakers. So, first up is Dr. Daniel Rodriguez. He is the infectious disease specialist at CHI St. Joseph Health, and I welcome him to the podium.
While I do work at St. Joe's Hospital, I'm one of many doctors working on this, many nurses working on this. It's not one person doing this. There's been a lot of work over the last 18 months. Our group has been working in most of the hospitals in town, at Baptist as well as at the St. Joe's system. We've been here from the beginning, and I got to tell you, it's still hard to accept that this is occurring, but it is happening. I still have people calling, even family calling me saying, I don't know, in the very beginning it was overblown. But I got to tell you, let me pick up my math. that it's for real. You know, in the beginning we were overwhelmed a little bit. We were working on PPE. We talked about different measures to slow this thing down. And I think on the whole, we were fairly effective. We were able to take care of patients, not running out of medications, out of beds. Very comforting. Come in June, May and June, we were feeling a lot better about this whole thing because the cases were down. But this is a new illness, and it is changing. So Delta came along. It's not COVID Delta, it's COVID-19 with a variant called Delta. And Delta really took over. From between the end of May to now, it probably represents about 97% of all the isolates in the United States, including Lexington. And it's different. It's not the same variant that we had starting this out. And what do we know? We know that this is more contagious. We can see that, for example, within our hospitals, there's a lot more husbands and wives coming in together, families coming in together that infected each other, and they're still surprised. But we can have some hope. Because the vaccination, while now it's FDA approved in terms of the Pfizer vaccine, there is vaccine available for all of us. And let's focus on a couple of things. One is, it's been fairly safe. There are no major complications, and when they're being tracked, those complications probably are the same as other vaccinations that are available to our children and to ourselves. So that's one good thing. And we know that they're being tracked. It's not something that's being put behind us and not paying attention to. We're still paying attention to different reports. So somebody can come back to me and say, well, what about this report? What about anaphylaxis? What about this rash? What about... That is being tracked, and on the whole, it is still thought to be safe enough to be used, now FDA approved. And then the second point, a lot of people say, well, why should I get vaccinated? Because there's breakthrough cases. Well, there are some breakthrough cases, and it's something that we're going to have to continue to track. But what is the important message from this? We are seeing the majority of people that are really sick in our ICUs, that are on ventilators, are persons not vaccinated. We're not seeing vaccinated patients on the whole being on the ventilators, being in the ICU. And that's not only here in Lexington, that's nationwide, that's worldwide. If you look at data from Israel, Iceland, different places where they were really vaccinated, you know, their populations were vaccinated up in the 80, 90 percentile, they do have breakthrough cases, but the same thing holds true. Cases have been going up, but the deaths have not been going up. That is encouraging. That is telling us that we are having some protection from this vaccine. So what can you take away from this? One, it is still happening. Two, our hospitals are being pushed. Our staffing's being pushed. We are looking at nationwide shortages of some of the medications we use to treat really sick patients. That's important. So how do we deal with this? It's not just about us having the technology, the expertise, the ventilators. It's about an entire picture. And the entire picture is you can't just rely on an unlimited resource like nurses, doctors, ventilators, medications. It's an entire process that's involved. That means, on the whole, the public, what can the public do? We're all in this together. We can try to practice the best preventative measures we can. And somebody will say to me, well, masks, they don't all have a perfect article. And they'll pull an article here and they'll pull an article there, say it's not perfect. You know what? It's not perfect. But there's enough data to say that it does have an impact. So masking and hygiene and distancing has some effect. It's not perfect, but that's what we can practice on this end. And on this other end, vaccine prevention. We know the vaccine works, it's safe. That will help all of us manage this in the hospitals. Because without it, we're going to continue to get more cases. We're going to be stressing the hospital system. You're going to see people that need care for other things not get the care they need. Cancer patients, trauma patients, cardiac patients. They're not going to go to the hospitals. They're going to wait too long. They're going to get sick. And we're not going to have the beds to take care of them. It has a big impact. What else is going to happen? issues with addiction, issues with, it stresses the entire system. So if we can get on board with our public preventative measures as well as vaccination, I think we can try to manage it. Are we going to cure it? Not right now. No. It's a new illness, and we're all trying the best we can to manage it. But without these measures, it's going to get harder. It's going to get harder, especially over the next month. So hopefully the message that people get is, let's work on the prevention aspects. Let's not really get political about, this is not a Republican or Democratic issue. This is not right or left. There are some really simple public health measures that have been used in the past and that should be used now. We have a vaccine that's now approved. Let's get on board and try to vaccinate and protect all of us, protect your loved ones and yourselves. That's all I have to say. Thanks.
Let's hear now from Dr. John Wilson, who again is the Deputy Chief of Staff for the Veterans Administration. Welcome, Dr. Wilson.
Again, I'd like to thank the mayor and her staff for allowing us the opportunity to take part in this and get some messaging out. Just a few things for the Lexington VA healthcare system. First off, as far as how we're doing, we are still open for business, both for COVID and non-COVID care. And I'm happy to say currently we're doing okay as far as inpatient beds and staffing. We are currently able to meet needs. While we do have a dedicated COVID area and COVID rooms, we have stood up again an expansion ward for COVID care in case that becomes necessary. For veterans, as far as testing, again, testing is still widely available. For mild cases or if you have concerns for routine testing, please call in, and it is available through our drive-through testing clinic at Leestown Road campus, and that is by appointment Monday through Fridays. As far as vaccine, again, which is the most important part of this fight, vaccines are widely available, again, for all veterans of all types, their family and their caregivers through the Save Lives Act. So again, we have vaccination widely available, again, at our Southleigh campus on Leestown Road as a drive-through, Monday through Friday, 8 a.m. to 3 p.m. Also, if you're visiting our Bowling campus, which is our inpatient hospital and acute care facility next to UK, if you're there on our second floor in the 2 West Clinic, it's also available 8 a.m. to 3 p.m. As far as protecting our staff and patients, again, it is federally mandated that all visitors, staff, patients are masked at all times while on our healthcare campuses, both at Leestown, the Southleigh campus, and Bowling, which is our acute care facility next to UK. As well as vaccinations for staff, you may have heard that it is federally mandated that by mid-October, all federal healthcare workers be vaccinated. And I'm happy to say that our staff is nearly 85% vaccinated already, and that number continues to grow. So at this time, I would just like to reiterate that vaccine is the main weapon here to try to curtail this, and it is widely available for both veterans, their caregivers, and their family members. So please reach out to us, and if not through us, please get vaccinated someplace. Thank you.
At this time, we'll hear from our new superintendent. I'm not sure how long we get to say new since you've gone right into it. Dr. DEMETRUS LIGGINS, welcome to the podium.
Thank you all. And just for clarification, I'm not a medical doctor. I have a PhD in education. So what we are finding in our schools, although we're making every effort we can to make sure that our students are kept safe and our staff is kept safe, we're wearing masks, we're doing certain protocols to ensure that our staff is checking their temperatures daily, along with asking parents to do the same for their students. We're still finding that we are having cases that are occurring. What we are mostly finding is that those cases are occurring within our wider community, and it is not in-school spread. And so what that tells me and what that tells us is that we need to adhere to some of the protocols, or all of the protocols that is being advised and recommended through our wider community, medical community, that is suggesting that people continue to get vaccinated, that people continue to wear their mask when inside. Because what we're finding is our students are coming to us from their home environment or from a public environment, or our staff that's coming in and have been exposed elsewhere and causing us to have issues in our school buildings. As you may or may not know, it is our number one goal this school year to make sure that we can ensure in-person learning continues for all of our scholars at each of our campuses. Our students have had a really rough few months for the beginning of the 2019-2020 school year, when abruptly in March they were forced to be at home learning and our staff was forced to learn it overnight. Then throughout the majority of last year, we found that our students were at home. And this year, although committed to being in person, we are finding that our students and our staff are suffering because we have the in and out of school for quarantines. And so I really urge each and every citizen to adhere to the advice of our medical professionals. Please become vaccinated. Please continue to wear your mask when indoors and when in large crowds. And please just take care of each other. We're definitely part of a larger community, and we want to make sure that we're taking care of ourselves, taking care of our families, but most importantly, that we're taking care of our children. So thank you for your time.
Dr. Craig Humbaugh, our Commissioner of Health, who has provided incredible leadership throughout this pandemic, could not be with us today. However, Kevin Hall, the communications officer, who many of you know, Lexington Health Department, has joined us. So Kevin has become a familiar face on TV with his frequent updates. So I would like to welcome Kevin to the podium.
As the mayor mentioned, I am not a doctor, and unlike the people behind me, I'm not a nurse, I'm not a doctor, I have no medical expertise, but I do represent public health. So I want to take a few minutes to let you know what public health's role is in all of this. We want you to be protected and prevent this so that you don't have to see the people behind me, so that you don't end up in the hospital. Protection and promotion and prevention are three key parts of public health. I have some numbers that I want to get into, but I also really want to take some time to talk to the people who are watching. I know a lot of you already have been vaccinated and are probably tuning out. A lot of you are probably never going to get vaccinated and are tuning out. But I hope that you'll take just a few minutes just to listen and to maybe not hit the laugh emoji or the angry emoji and when you're watching this, and just listen to what we're actually talking about. We're here in public health to take care of all the 330,000 plus people in Lexington. For those of you who have supported us over the last 18 months, we're here for you. For those of you who have fought us every step of the way and don't believe in what we're doing, we are here for you. We are trying to protect you. I did some interviews recently with Radio Lex and had this come up, that this time last year we were talking about the people who were dying from COVID-19, and a lot of what we heard were people were saying, well, they're 80 years old, they're 90 years old, these are people who are at the end of their lives. And my response is, yeah, and these are still people. These are still people who are members of our community. These are still people who they've lived full lives and still had life ahead of them. So we don't want to discount those deaths. And what I'm seeing too much of now, and this is for any of you who spent any time on social media, this isn't news to you. But what we're seeing from people is, well, the unvaccinated people are the ones who are dying from this, and this is what happens. And my response is the same. And we don't want anyone to die from this. Whether you're vaccinated, unvaccinated, you are still a member of this community, and we want you to live. We want you to be protected. And I say that so that we don't discount and start getting into who should die and who shouldn't die. We don't want anyone to die from this, and we can prevent that to the best of our abilities, as you've heard already, by getting vaccinated. The vaccine, let's look at some of the numbers here. These are just Lexington numbers. You may see some of the numbers from the hospitals that are bigger than this, but keep in mind the hospitals are regional. They're going to get people who are outside of Lexington. So these are just Lexington numbers. Since February, 88% of all hospitalizations, so that's 571 out of 655, 88% have been among the not fully vaccinated or the unvaccinated. Taking that to the ICU level, so severe critical care, 94%, or 108 out of 115 have been among the unvaccinated or not fully vaccinated. Looking at what we're seeing currently, It is 79% of hospitalizations and 90% of ICU cases are among the unvaccinated or not fully vaccinated here in Lexington. Say all that to remind you that we can get protection from this vaccine. Yes, you can get vaccinated and still get COVID-19, but first of all, you are far less likely to get it. Right now, more than 75% of all cases in Lexington, current cases here in August, have been among the unvaccinated. So one, you will get protection, and a lot of protection. But two, and what we're talking about today, and perhaps even more importantly, is studies and the numbers themselves play out will show that you are far less likely to end up in the hospital, and you are far, far less likely to end up in the ICU. And again, I want to remind the people about getting vaccinated, that I've heard from people who aren't vaccinated who are afraid that they're going to get shamed, that they'll be ridiculed. And I want you to know that there's not a person who is giving that shot, whether at one of these medical facilities or at the health department, who will do anything other than to celebrate the fact that you're getting vaccinated. We do not care what has stopped you from getting vaccinated up to this point. We are here to celebrate with the fact that you're getting vaccinated today. Do not let that fear of being shamed, that fear of being criticized, that fear of being judged stop you from getting vaccinated. If you're familiar at all with what public health does here in Lexington, we treat STDs, sexually transmitted diseases. There's no judgment there. We're happy that you're getting treated and not spreading this to others. We have a very successful harm reduction program to provide clean needles to people to prevent them from spreading HIV and hepatitis. We aren't judging you. We're happy that you're taking those steps to protect you and others. And let's take that into this world of COVID-19. We are just happy that you'll take the step to get vaccinated. So do not let the fear of being judged stop you. You will not be judged. We will celebrate. The people up here will celebrate you. So as mentioned earlier, we have started giving third doses to the immunocompromised here in Lexington. The health department has vaccine, and we have all three available every Monday, Wednesday, and Friday by same-day appointment. You just give us a call at 859-288-2483, and we can get you an appointment to get vaccinated. It's really important, though, to distinguish between the third dose for immunocompromised and what you've heard of the booster dose, because they are different terminology for a reason. The third dose is what's been approved right now by the federal officials, the FDA, the CDC, for people with specific immunocompromised diseases. So you're looking at people who have, for instance, active cancer treatment, people who have received an organ transplant and are taking medicine to suppress the immune system. This is not just every illness. There are very specific illnesses that are covered by this. This is not the booster. What the studies have shown, this is why the approval came for the third dose, is that immunocompromised people need that third dose to get stronger protection against COVID-19. So if you're out there and you're thinking, you know what, I'm going to go ahead and get this. I don't qualify, but I want to get that booster dose. You're jumping ahead of people who absolutely need this right now, some of the most vulnerable members of our community. So wait until the booster gets the approval. It might not get approval. The FDA has said that, and the White House has said, officials here in the state have said, they're looking at if that booster will be needed. And while it is expected that the booster will get the clearance and the approval will move forward with it, right now there's no information that that booster would be needed for anyone. So again, the third dose right now is for immunocompromised people. And then the last thing I want to touch on, and this is really important to me because I'm not a doctor, I'm not a nurse, but I am the father of a 2-year-old who is not eligible to get vaccinated. So protecting these young kids is so important for everyone. I've seen people talk about, well, what about you're not seeing the kids dying, you're not seeing the kids getting hospitalized. And I don't think that that's who we are as a community, that we need kids to end up being hospitalized or dying before we take action to protect them. I think any of us as parents and as people who care about those around us will do everything we can to protect those young people and those who are vulnerable. 15% of current cases in Lexington are among ages 5 to 17 years, and that has been growing every month since June. If you look in June, there were 31 cases among ages 5 to 17. In July, that was up to 272, and so far in August, 458. And then by another point of comparison, the first 23 days of July reported 168 cases among ages 5 to 17. and that's compared to 458 through the first 23 days of August. There are things we can do to stop this. There are things we can do to slow it down. And the first step is to get vaccinated. Keep wearing your mask. Keep staying 6 feet apart from others. And keep encouraging people who mean something to you to take these steps. I'll be here for questions afterward, and thanks for the opportunity today.
Next, Andrew Lanham with Wild Health will talk about the testing sites. Andrew?
I am pleased to announce that we are opening 3 new testing sites for school-aged kids from pre-K to 12th grade students, as well as school faculty and staff. We are currently only offering the PCR tests at these 3 locations, and we may eventually move to rapid testing at those locations as well. But as for the beginning, we are going to stay with the PCR tests. Those 3 locations are going to be South, Central, and North. The South location will be at Emmanuel Baptist Church, which is 2261 Armstrong Mill Road, Lexington, Kentucky. So that clinic starts August 28th, and that clinic will run Monday, Thursday, Friday, and Saturdays from 2 p.m. to 6 p.m. The Central location will be at Fayette County Public Schools, 100 Midland Avenue, Lexington, Kentucky, and that starts 8/26, which is this Thursday, and it will be open every single day from 2 p.m. to 6 p.m. And our North location will be at the Lexington Legends Ballpark, which is located at 207 Legends Lane, Lexington, Kentucky, and that one starts 8:31, and they will be testing from Tuesday and Wednesday, 2 p.m. to 6 p.m. Same-day appointments can be found and made at lexington.wildhealth.com. You just choose your location that is most convenient for you through that website. All of these sites are walk-up and not drive-through. The reason for this being that this provides a faster experience and shorter lines for our patients. Thank you so much.
I just want you to look one more time at this group of professionals, each of whom has spent the last 18 months sharing, asking questions, working for the greater good of our health care. So again, thank you to each and every one of you.